Good afternoon, everyone.
Good afternoon.
Thank you for being here this afternoon. I'm very I'm thankful for great partners in our community. Senator Perry, I'm particularly thankful for you being here today. I guess last Wednesday we last talked, and since that time we've had many conversations in the community and federally and at a state level. I'm thankful for the folks at Texas Tech, for our school districts. I see Kathy here. I'm sure some of the other leadership may be here. Just this morning, we had a chance to talk with the superintendents of our three largest school districts. We've been in constant conversations with the folks at Texas Tech. I'm thankful for Covenant and UMC. I'm thankful for our partners at the county. I see Clinton back here. Thank you, Clinton. We've been on the phone with Judge Parrish quite a bit. The nonprofits have been fabulous. I'll talk a bit more about them in a minute. The media has been great. I'm thankful for our media and the responsible way that they've handled this and how thorough I think they've been in their efforts. The business community, Jarrett and I started this morning early with Eddie McBride, and Eddie and I have been on several other phone conversations today. As an example, we just spent time with the local restaurant association and just to talk through them. They're a huge part of our economy statewide. They're the second, I think they argue they're the second largest generator of the state economy. They employ 1.5 million people statewide. They're very important to us. We've also had a great response from our utilities, from Suddenlink and from AT&T and from Atmos and many others, and we will I'll ask the council this evening to take action to allow LP&L to get in that group also, so we're doing the right thing in this time of challenge for our citizens. I'm thankful for the collaboration and the commitment to work together. Tonight, this evening, at 5 o'clock, we will have an emergency city council meeting, and at that time, I will declare a public health disaster. Included in that will be limiting public gatherings to no more than 200 people. In that same breath, we would say that we also would encourage people to follow the CDC guidelines, which were published last night. And if you've had a chance to see them, they're interesting. They say 50 people is what their suggestion is, but if you read all the way through it, it's hard to really understand exactly what they're saying. But we feel like 50 people and continuing with our hygiene and social distancing are important. If you recall last week, that's what we talked about in our press conference, was that the hygiene, the washing your hands, the coughing into your sleeve, the social distancing, and none of that has changed. That disaster declaration will exempt out our schools and a number of others. Jarrett's going to talk about that in a minute. He understands the details of that even a bit better. But our schools have a separate protocol that they are following. In fact, there's 10 pages that the CDC has put out for K-12 schools to help them make their decisions, and it has different levels of what your community is experiencing. Remember, we still do not have a confirmed case in our community. And as we stand today, our schools, our public schools, Lubbock ISD, Lubbock Cooper, and Friendship ISD still plan on having school next week. They will make that decision together if something were to change. They've worked together. I'm thankful for them. We will be at the table with them to the degree they'd like us to be there. We'll invite the county to be there too, because we feel like the other districts in Lubbock County will very well go along with the decision that would be made by our three largest school districts. So you might say, why are we doing this right now? And I would offer these reasons. First of all, we think this is a measured response. We think it's proactive and preemptive. In some ways, we're approaching this a lot like we would approach a major winter storm. You prepare in advance. You don't want to get caught off guard. And I believe that we've been successful. I think the no confirmed cases is very much of a positive for our community. We still feel like we'll have to report something different at some point, but that's where we are today. I hope that as a community we can take a real deep breath. I've heard the arguments, and I know that I'll be accused of overreacting. And if that's the case, then I'll be guilty as charged. But I think when I read the City of Lubbock Charter, and I know the spirit of the men and women I serve with on the Lubbock City Council, we take very seriously that our charge, that job one is the safety of our citizens. And in that regard, I don't think it's worth the risk of not acting. Please, when you go to our grocery stores, shop for a week's worth. If you will do that, those shelves will be full by the middle of this week. My last stop before coming out here was at the United Warehouse. I got invited out there today to talk to a group of men and women who are stocking, who are doing the pulling and loading up the trucks. And they've worked, prior to today, the last 3 days, they've worked 16, 14, and 12-hour shifts. Today, they're going to just work 9, okay? They're the first responders, along with our men and women in uniform. That's where the stress has been felt in our system. And let's just use common sense around that, please. As we speak right now, the United Way, under the leadership of Glenn Cochran, has brought together 10 of our nonprofits, and they're having a discussion about what we can do as a community to provide for our citizens that may have needs caused by this emergency, whether it's child care, whether it's gap funding for families, whatever it may be. I look forward to hearing what they come back with, but they're stepping up today to I think to address a community need. That doesn't surprise any of us that know those people. I'll close with this. You may remember in the height of the AIDS epidemic in the late 80s, I think it was 89, then there was a press event where she took a picture of this baby who had been tested as HIV positive. And she was hugging this baby and talking to this baby much like she would one of her very own kids or grandkids. And there's certainly a big difference between HIV and what we're dealing with coronavirus. But I think it helped calm people a bit. So when we talk about social distancing, that doesn't mean lock your doors and never come out of your house. In fact, my wife keeps looking for that line that says she can't work in the yard. It's not in there, okay? But check on your neighbor. Check on the people that you love. I found it pretty unusual yesterday afternoon. Instead of being at Dan Law Field, Rip Griffin Park, I got to call and spend 30 minutes on the phone on a Sunday afternoon talking to my parents. And that was That was good for, I think, for both of us. But let's love those people that we know and the ones we don't know. Let's not forget that the strength of our community is our people and how we take care of each other every day, particularly in a time of crisis. Thank you very much. Thanks for letting me share this with you. I'd like to introduce Katherine Wells, who is the director of the City of Lubbock Health Department. Ms. Wells.
Good afternoon, and thank you, Mayor Pope. I want to say thank you to the city. Our health department over the last couple of weeks has had so much support, so much stuff going on behind the scenes to allow my staff to do the important work that we need to do, and I really appreciate that support. Today I'm going to just provide another update of what we've been doing since our last press conference, which was only back on March 11th. I'm finally getting used to doing all of these. We continue to closely monitor the situation and are really still following those long-standing public health plans that have successfully been used in the past. Dr. Cook, our health authority, is unable to be here today. So in his place, I have Dr. Douglas Klepper, who many of you know is a local pediatrician, and he's been filling in and assisting the health department for the last couple of days. And he's going to give us a quick update on the coronavirus, and then I'll go back and do some updates on what we're doing at the health department.
Thank you.
Thank you.
Thank you. My name is Dr. Douglas Klepper. I'm affiliated with a lot of entities here through the school district, the many medical facilities, and fortunately take care of a lot of these kids and these parents in this room here. So very near and dear to me. So I'm here basically to kind of give you a little bit of scientific update of what's really happened in the past week for us up with that. We are definitely moving forward with clearly awareness of things. We're getting better about doing some of the screening processes. Often I'm asked, what's the first thing you're going to be finding out if I'm concerned about coronavirus? Almost inevitably right now it's going to be about travel. Where'd you come from first? Because that's how it's going to get here. It's going to come by travel. We're going to ask you some screening questions of what kind of symptoms you have. Do you have fever? Have you had chills? What kind of symptoms have you had? A persistent cough? Those kind of things. And we're going to go through these list of questions, and every doctor's office is capable of doing that. I encourage you to use those local resources, not only the online screening things, but the local providers. I know this morning at our office, we had about 30 calls that were just to find out what those criteria were. We've gotten back to all 30 of those people. Be patient with us, because the situation is this takes a lot of time for the providers in this community to address these issues, but they will be addressed. I am very assured of that. Things that I can tell you, we know the things that make a difference with the control of this particular virus. By all means, social distancing. A good example of that was when the announcement came from the president on Friday. The situations, there was a lot of things with the president up there and everybody gathered together. We know now that wasn't probably the best message that was being sent. We should all get as much distance as we can. And I know from the people who went to church yesterday, a lot of people saw that, and that's a natural thing. Second thing, by far and away, hand washing, hand washing, hand washing. We know now that the virus, we used to say if it was coughed or spit upon something, would last about 24 hours. We now know that it can actually last up to 2 to 3 days on hard surfaces. So if you've been around somebody's coughing and sneezing, wipe it down, get it disinfected. There's nothing cheaper out there right now than isopropyl alcohol. You can take a little bit of that and clean it off. That's cheap and easy, and it doesn't involve you standing in a line at the grocery store. Third thing, obviously, once again, is basically if you've got a choice, don't put yourself at risk. I applaud what they're making for the recommendations on the gathering of the groups, because that is social distance. It is by bringing all these other people together. I think it's a very bold move, and I think that's what we all need to be doing right now. We will weather this. This is something that we will weather. And when it comes to medical treatment that you're all going to look to for your physician, the first thing we're going to say is take a deep breath, drink some water, and take care of yourself. We know that if you are well hydrated, you get appropriate amount of sleep, and you do some light exercise. That's one of the best things we found to boost an immune system. Light exercise, not excessive exercise, just some light exercise and getting outside. You're not going to get sick by going outside. Okay. With that, I'll turn it back over to Katherine.
Thank you very much, sir. So this, again, is an evolving situation, but the department continues to follow the protocols for disease investigations. Coronavirus has continued to raise our alert level, but that core public health work is still being done. We've done expansion of our City of Lubbock Health Department hours. That started today. There will be people answering the phone from now 7 a.m. to 6 p.m. We've also added the number of individuals taking on those calls. So hopefully we'll be getting to all of the concerned individuals in our community and getting good feedback to them. The goals of the health department during this time is really continue to inform our local care providers so that they can identify risk. In order to get tested, you need to go to your doctor's office, and your doctor's office is going to screen you. We're trying to test lots of individuals, but those with the signs and symptoms are the ones that need to be tested right now, and we have to work with the doctors and the CDC guidance to get that done. We're also working to facilitate that testing. So testing can't be done at the health department. It's done at our local response network laboratory, which luckily we have one here in Lubbock. But those samples, the doctor has to collect the samples, and then those samples have to go to that laboratory to process the testing. Thankfully, that testing turnaround has been very quick. We had some test results come back within 8 hours over the weekend. So I really applaud that lab for getting results back to us. But we also don't want to overburden that lab. Our goal is to investigate all suspected cases of coronavirus. So if we diagnose somebody with coronavirus, we're going to do what's called a contact investigation. We're going to look for those individuals who've been in contact with that person. If that's a student, we're going to be calling that school. We're going to be calling that school nurse. We're going to be making those notifications. If they're in a workplace, we're going to ask that person, we're going to pull that person out of work, make sure that those people that have been around them know about it and start monitoring for signs and symptoms. We also want to react quickly. So as soon as we find or when we find a positive case, we want staff out there interviewing that individual, figuring out where they've been, when they were infected, and try to contact as many people as possible. And these steps are really done to reduce the virus in the community. If we can identify that individual that's carrying the virus and test everybody that's around them or monitor everybody around them, then we'll keep that virus from spreading. And that's important. We don't want to spread the virus into those vulnerable populations, especially we don't want it into our nursing homes. We don't want it into the hospitals. And then currently there's no vaccine for COVID-19. So really the only prevention we have is reducing the spread through the social distancing. So we really ask people to cooperate with those social distancing guidelines, and we really want people to reduce their contact with other individuals as much as possible. And as the mayor said, it's still important to go outside, go out, garden, lots of things to do with your families, but really avoid those big public events. And then a little bit more about the testing. We've had lots of questions about we're not testing enough people. People are frustrated. But one thing to remember with the testing is the testing isn't going to change the medical treatment you're going to receive. This is a virus. The doctor's going to treat you the same way, regardless of regardless of whether or not you're testing positive or not. The testing's really for the public health system to understand whether or not we have the disease here. And then we want to make sure we test those people that might be in contact to those most at risk. So a person that's working in a nursing home or a person that's working in a hospital, we need to know if those people are positive so that we can make those recommendations, do appropriate cleaning, and isolate individuals. So please bear with us as we're working through all of these different testing protocols. We're really trying to cooperate with our doctors, get that done as quickly as possible. I'm going to go ahead and pass this on to our city manager, Jarrett Atkinson.
Okay, well again, thank you everybody for being here. Some of what I have today is a little bit repetitive. We've done this twice. We're doing it today, Monday at 3 p.m., and of course we will continue to do these Monday at 3 p.m. So as a reminder, this is still a three-step response. It's a three-piece response. This is your public health system and your public health authority. This is what they do. The plans that they use to address any kind of a potential pandemic are long-standing, they're well-tested, and they're what we're following. They're working today, and over the long term, they will work. What I'll talk a little bit more about today is the third step of that, and that's what's the rest of the city doing? What is the rest of our operation? So again, I'll take you back. I told you we have two primary missions for our city operations. The first and the most important, support the public health system. Be sure they have the logistics and the resources that they need. Second, it's to maintain our essential services. So as we've gone over the period of time since last Wednesday, we'll talk a little bit about coordination. It's already been covered to some extent today. We've been conducting joint meetings all across town, really all across the region. Last Thursday, myself, our Director of Emergency Management, our Fire Chief, had the privilege of meeting with our three large school superintendents. We certainly appreciate being involved in that. As the mayor said, our job is to support them. It is not to put ourselves in the place of those school districts. It's rather to help them with decisions that they may choose to make. So from the city standpoint, Dr. Rollo and others, we sure appreciate the opportunity to participate, and we'll continue to do that, and we'll continue to provide that support. We continue working with the other West Texas cities. I think unless something's changed since we sat down to get ready for the conference today, outside of El Paso, there are no confirmed cases in West Texas. No confirmed cases in West Texas outside of El Paso. But nonetheless, we continue to coordinate with those cities as well. We have the Mayor of Wolforth here with us today. Mayor and I have been working different times with Lubbock County, primarily Judge Curtis Perry. As you heard from Katherine, we've expanded our capabilities to take your calls at the Public Health Department. So the call volume has gone up, and that's good. That's what we want. If you have questions, call. I want you to know that beginning at 7 a.m. this morning, though, we actually opened basically a second call center and staffed it up so that we can be prompt, take those calls, and get back to people. We're going to continue to do that, and we'll do that until the demand drops. So that's an example of supporting the operations. Give you kind of an example of self-regulating, so people that are already practicing social difference. Passenger traffic at Lubbock Preston Smith International Airport, I think, might be a good example of that. So if you look at yesterday at the airport, which was spring break Sunday, and you compare it to spring break Sunday a year before, we dropped from an average of about 2,000 outbound passengers to just under 1,000 outbound passengers. So outbound traffic yesterday at our airport was down 55% from the same trigger 1 year before. We don't have today's counts yet, but the projections that we get on that, and this mainly comes through the outbound screening, is similar, about a 55–56% reduction. I would note that both in the part of the airport that the city controls and operates, and the part that the TSA operates, and those pieces that the airlines operate, all of those have had all of their cleaning protocols enhanced, elevated, moved to multiple times a day, and they'll continue. Our Emergency Operations Center, which is actually the building behind us here in the parking lot, that's been staffed from the day that this began, staffed with emergency management personnel. Beginning tomorrow morning, we will go ahead and activate. So this brings on additional capabilities. We will activate the EOC to what we call level 3. That is our lower activation level. And this is being done to be sure that we are increasing our capabilities for logistical and for resource support. It's going back to that primary mission of supporting public health. It's not a response effort at the moment. We have no cases to which we would respond. We're not having any absenteeism or any difficulty delivering essential services. If those things were ever to occur, we're already activated and operating and can build that operation out. A few general items, and if y'all would humor me, I'm going to try to address a few of the comments that we get. We track all the social media and try to be sure we can speak to those things that are possible. First, throughout the community, we are already seeing local businesses that are self-regulating. They're changing their operational plans, their operational structures, and they're doing that in response to the event. It's social distancing. We appreciate that. It's going to work. It is going to help. And we really look forward to others joining them. We look forward to all of us as individuals really making those smart choices to self-regulate. If we do, we will delay or we will eliminate the confirmed case. It's not out of the question that it'll happen, but it's not inevitable. And we change that with those good decisions. So to those businesses that have already done so, thank you. We really appreciate it. We have a lot of questions about testing, a lot of questions that are coming in. Just know, under federal guidelines, we cannot release the number of tests that have been submitted. But rather know this, we have no shortage of testing capability at our local lab. They are doing tests, and your assurance for that is this simple. That lab, by law, has to report on a daily basis back to Public Health Authority. That report tells us that if there was a test submitted, it's processed, was it a positive or was it a negative? If it's a negative, it clears the deck. If it's positive, Ms. Wells and her group go to work. We have no positives, and we absolutely have accountability and reports on every test that has been submitted and is working. Many of you may have heard the federal government today was releasing approximately 1 million more test kits into the United States. That's positive. They're also announcing that the private labs will be coming online. That is also a positive. It increases the universe that's available. But know that here in West Texas, that lab has had no issues in having the testing kits and having the ability to process, and as Ms. Wells said, process in a very, very quick manner. So that's going good. Our governor last week did a press conference, declared a state disaster declaration, went through a sequence of items. One that generated a lot of questions was driving testing. Do we have it here in Lubbock, or do we need it here in Lubbock? Are we going to get it? At the moment, we don't. It's not out of the question, and it's not out of possibility, but we don't have it here, and we don't have it because we really don't have the demand for it at this moment. There's one that is open in Texas, and it's in San Antonio. There are 2 more in large cities that are expected to come online. Know that these facilities, these drive-in testing facilities that were discussed, are designed to serve public safety, medical community, and personnel who operate critical infrastructure. Those will eventually build out and serve a larger universe than that. But today, that's what those labs are doing. The governor also talked about testing for those who do not have a primary care physician. I think we've also heard this from the federal government. If you are in that situation, contact our public health department. Call those numbers. They will help make arrangements. You're not going to not be tested simply because you do not have a standing doctor. Okay? The system behind that is robust. We will work you through that, and we'll help you get that test if the medical situation dictates.
Free of charge.
Free of charge. Free of charge. Talk a little bit about the council meeting today. I think Mayor Pope's done an excellent job of covering that. We will meet at 5 p.m. at City Hall. So media, thank you very much for being here, and I hope I get to see you again not very long from now. That is to consider issuing that local declaration, and included in such are potential limits on public and private gatherings. This is a preemptive response. It is building on what we've been doing for the last several weeks. As the mayor said, it's not different than a blizzard. It's not different than what you see the state and local government do when a hurricane's projected to make landfall on the coast. For those that work with the city, one of our big rules when we get into a potential disaster or emergency situation, we don't want to be behind, and I don't want to leave anything parked. Now, fortunately, that's usually because we're looking at snow or ice or something to that effect. But the same rule applies here. We're not going to get behind, and we're not going to leave any of our resources parked. If the call is made and those are needed, they're going to be ready, and we're going to deploy them. The declaration that the council will consider tonight supports that. So, I think we're going to stop. We probably have 5 minutes before we've got to move everybody. We'll be glad to take some questions, and for myself and our 3 others, if we get questions, let's please stand here at the podium so the mics will pick us up. So, I'll try to moderate. Who goes first?
I guess.
Hang on just a second. Matt?
Thank you. Why is travel history weighted so heavy still when this is getting spread within the community? And Has that changed at all since last week?
You wanna do that?
The travel history is important here because we don't have any local transmission. But when we're looking at travel history, that travel history is changing. So before it was international travel just into China, now we're looking at individuals that have traveled in Europe, and now we're even considering travel history of those that have been around the epicenters in the California, on the West Coast or in New York. So there's a lot more that qualifies as travel history, and that's updated every day.
Good question, sir.
Emergency declaration and limiting crowds. One thing that started today was a stock show at the fairgrounds. Do we know if that's going to continue or be allowed?
The ultimate answer to that will be up to that entity under these conditions. The proposal that will be presented to the mayor and ultimately to the city council is limiting it at 200. We also propose a 24-hour window before that goes into effect. So if it is to be enacted tonight, it will go into effect tomorrow, Tuesday, at roughly 5 p.m. We have advised the show of that. They have the ability to respond to it at this point. If not, and the council does take those actions, that will be when that stops. So, Mayor, did you want to add anything to that?
I think you covered it.
Okay.
About an hour ago, the president said he had changed, now he was limiting 10. That was his recommendation. I know 200 is an arbitrary number. Mayor, why 200? Is that you're following CDC guidelines?
Well, first of all, I haven't seen the president's comments. I think our decision is based upon the fact that we don't have a confirmed case. Guidance from our public health authority, our public health department, and trying to make what I think is a fact-based decision, like we talked about last week, using common sense and the very best information that we have. If something changes, we can always adjust, but we feel like this is the appropriate spot to begin.
Now, I would add just briefly to that, if you review the CDC guidance that came out last night, it also directs you back to those local decisions at the recommendation of the Public Health Authority, which of course we've been in consult with all day today. So good question. I think we'll do one more. Matt?
Okay. So going back to testing, sorry to keep bringing this up, but like, can you shed any light on how many, because I've heard, 3, I wouldn't be surprised if it's 3 or 100. Like, can you kind of give any, just shed any light on the numbers?
We're not going to be releasing the number of individuals testing. However, throughout the state of Texas, there are individuals in every community that are being screened and sent to those local response network laboratories for testing. And that's how we've found the positives that have been here in Texas so far. And we will continue to work through those guidelines and get individuals tested.
The other Matt has one last question. I'm so sorry for Ms. Wells. We had a viewer call in and say, hey, if I don't have health insurance, can I get tested?
When you get tested through the public health lab, there is no cost for that test. So there have been some individuals that haven't had a primary care provider, and we have gotten them into a place to get that collection done and have gotten them tested.
Okay. Thank you all very much. Most of us need to head back to City Hall and get ready for the 5 o'clock meeting tonight.